I want to ask a question that I actually addressed last year, it would have been last year during the budget hearing. It has to deal with our surgery centers and the proposed tax. And as I said last year, the governor proposed a tax on these centers, and many of these community-based surgery centers are where a lot of people go. A lot of Pennsylvanians go for colonoscopies, endoscopies, cataract surgeries, orthopedic procedures, and on it goes. And I think we're very fortunate, and I know, and definitely in Lancaster, that they provide quality care, efficiencies, and significant cost savings. At least that's my understanding to patients, employers, insurers, and others. I mean, that seems to be the case, rather than having to go to the hospital and things like that. And then we actually passed legislation to encourage use of these facilities just for that reason. We thought it would be a benefit. Now, ultimately, last year when we addressed it, when we looked at the budget, the General Assembly did not include this as part of the tax package. And lately, a lot of the budgets have been very tight. And I just was kind of curious, because it seems like they're a positive. They save costs. It's positive. Why would we want to propose a new tax on these ambulatory surgery centers when a lot of them are small businesses? It seems like it has a positive impact on our health care, and like I said last year, it doesn't feel right. I don't know why we're targeting one specific business, and that's always, to me, that's problematic.
Yeah, so I can address that if that's okay. So in the Medicaid or the Medical Assistance Program in Pennsylvania, we really have some abilities to try and raise our own funds to help support the cost of the medical assistance program. And provider assessments are one mechanism that we use in various areas of our budget. The ambulatory surgical centers, we agree, are a great use of resources. They're cost-effective alternatives to inpatient care. And last year, we heard from many of you, as well as other stakeholders, that you weren't interested in something that would essentially not benefit the ambulatory surgical centers as well. So we went back and we had some conversations with those providers. And one thing that we learned through there is that the Medicaid rate is really so low that it's not covering the cost for them to provide services, and therefore only about 6% of their revenues today come from Medicaid. And we'd like to be able to offer them a rate increase. We'd like to be able to encourage the use of ASCs within the Medicaid space.
I appreciate the answer, but like I said, I think big picture, it worries me a little bit that we're targeting one business. What's next, in that regard? I just wanted to get on record, and I wanted to get your feedback on that. I will switch to a different subject. I did talk to Secretary Topper the other day, a question about the health choices procurement problem issue, train wreck, snafu, whatever you want to call it. And I was wondering, I went through great detail about that procedure, how the courts threw it out, how we didn't seem to have an open process. It doesn't appear transparent, the process. I'm not talking about the people, but the process seems to maybe lack integrity, when we went through that. And I was wondering what are you going to do? I do think it was more a DHS problem than a DGS, although they're the people that have to oversee procurement. And I want to know what we're going to do to ensure that your staff follows the procurement code in the future. And I am wondering now, you were not there, Secretary, at the time, I don't believe, but was anybody disciplined? I mean, through this process it was total violation of what was going on. Maybe you can give me some feedback on that.
So to answer your question, Representative, in terms of was anybody disciplined, I'm not aware that there was any disciplinary action. Mistakes do happen, I think, all the way around. But in terms of what we're doing going forward to make sure that any future procurements are more successful, our internal procurement staff are consulting with the Department of General Services and with their procurement specialists, as well as with the Office of Legal Counsel, to review all aspects of the procurement materials to ensure all of the required elements are met or exceeded within the procurement code. So I think we certainly are taking lessons learned and doing what we can to make sure that we avoid those mistakes in the future.
A couple things. When's the next RFP going to be issued? You know, and so that because there's a lot of stakeholders, there's people that want to be part of this, and they feel like they've been cut out of the system.
Well, in terms of being cut out of the system, I mean, we have to be careful, obviously, within procurement rules, who we talk to, the conversations we have, and that's part of what we're trying to do in terms of complying with the rules. But we've really tried to take this time to take stock in our program and look at opportunities to improve our program going forward. We have opportunities to enhance existing parts of our program, like our value-based purchasing initiative, our pharmacy benefit manager, amendments that we've made to our agreements already, community-based care management. We're sort of taking stock of our program and trying to figure out how do we continue to improve it, and then what opportunities are there to incorporate some of those aspects into the next RFP. So we certainly will be issuing it in the future. I can't give you a date at this point.
I just know we rely on our legal staff, and it was disappointing that this somehow got through through the legal process too.